you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast, dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. This week, you guys, I found myself wondering about vaccines. I've been speaking with my friends who have kids, and most of them have chosen to vaccinate, and others have chosen to go on a delayed schedule. And I wanted to understand more about this perspective as to why someone might choose a delayed schedule when really it's not necessarily recommended, at the very least, for that child's specific health issues. So, we're going to start out today with talking about measles, mumps, and rubella. The MMR vaccine is one that folks tend to get pretty early on, and I want to know about the actual diseases behind these vaccines. So today we're going to start out with measles, move on to mumps, and then rubella, and stick around to the end when we talk about who should get the MMR vaccine and what the side effects may be, as well as how these are regulated. So first up, measles, mumps, and rubella are all viral diseases that can be prevented by vaccines, and if folks are not vaccinated against them, then they do have the potential to harm non-immune pregnant women and their fetuses if they're exposed to the viruses. The most concerning out of the three is rubella, because that can cause congenital rubella syndrome and have some devastating effects on the child. So we're going to take a look at each of these, where they come from, how they work, and what it looks like when you have them. So with measles, measles is transmitted through droplet nuclei, and it's an RNA virus. So humans are the only natural host of this particular disease, and it's highly contagious. There are reports of measles cases in the U.S. that have mostly dramatically declined since the pre-vaccination era. However, we have seen rises of some of these types of viruses, including measles and mumps, within the U.S. in recent years due to a lack of vaccinations. So we're going to talk a little bit as well about some of these numbers. In the year 2000, the CDC declared that measles had been eliminated from the U.S., and we do still see some outbreaks that are a result of foreign travel. From January to September in 2011, there were 211 confirmed cases in the U.S. of measles and 15 outbreaks, and that was the highest number since 1996. Out of the 211 confirmed cases that occurred, 18% were among folks who had received at least one MMR vaccine dose. But until measles is totally eradicated, we're going to still see some outbreaks in the world and in the U.S. specifically. Right now, there are over 20 million measles infections worldwide each year, and there are hundreds of thousands of deaths each year as well. So if you get 20 million measles infections in a single year, and we take the number of a year like 2008, that is 164,000 deaths out of 20 million infections. So that's a mortality rate of about 0.08%, or if we round to the nearest 2 decimal points, 0.01%. If you contrast that with COVID-19, the crude mortality rate for that is 0.28%, so 0.28%, or for every 358 people, 1 person dies, or out of 100,000 people, 279 people die from COVID-19. If we reduce that down to the same units of measurement for per 100,000 individuals, then for measles, 820 out of every 100,000 people die from measles in a single year, if we use the numbers from 2008, for example. Now that said, the numbers that we used for the mortality rate of COVID-19 are from New York City. So that is as of May 1st of this year, 2020, and it was 23,430 people who were estimated to have died out of a total population of 8,398,748 individuals. So that's where we're getting these numbers from. So one is global and the other is just within New York City alone. Just keep in mind that that's a very high mortality rate for both of these diseases, and they are both viruses. There are different populations who are susceptible to exposure in different degrees. So epidemics still occur in developing countries for measles, especially those that don't have mass vaccination programs. And if you come into close contact with folks who haven't been vaccinated in those countries, as you might in airports, clinics, hospitals, then that can increase the chance of exposure for folks who are non-immune. So some folks who are non-immune may have autoimmune disorders, or they may not be old enough yet to obtain these vaccines, or have some other form of medical issue that would prohibit them from getting the vaccine. We've learned a lot from the microbiologists as well during COVID-19 in regards to social distancing and the importance of staying at least 6 feet away from each other. I'm sure that most of y'all have seen a lot of the same memes as I have and other viral internet sensations regarding microbiologists using their platforms and their educations for good and going and coughing into these agar plates with or without a mask and doing this at different distances from the agar plate to illustrate the effects of wearing a mask versus not wearing a mask, as well as social distancing. So coming into close contact with folks in an airport could very well mean just being 6 feet or less apart. You don't have to actually be right up on one another, but I don't know about you, but every time I've been in an airport, I have almost always been sitting directly beside another person, or at the most 2 feet away while just in the airport waiting. Not to mention lines for foods or beverages, or having to sit directly adjacent to someone packed into those planes like little sardines. So when they say close contact, think about what that really means. It doesn't mean that you have to be kissing that person or sharing a drink, but you could be right up next to them just based on the protocols of airports or hospitals and how things normally operate. A lot of the time, we tend to think of measles as being a childhood illness, but the demographics have shifted since 2001, in which half of the reported cases in the U.S. were folks who were 20 years and older. Outbreaks tend to be pretty rare in the U.S., but people who are not vaccinated may be much more likely to obtain and spread this. And it could lead to outbreaks because of how transmissible this virus really is. It's important for folks who are OBGYNs to be aware of any reported measles cases in the area and to monitor non-vaccinated patients closely for exposure and also symptoms. When you're spreading measles, it's communicable for at least 8 days. After 10 to 12 days following exposure, you might have about 2 to 3 days of a fever, anorexia, and just generally feeling like crap, combined with a cough, pink eye, and coryza, which is actually an inflammation of your mucous membranes in your nose. And it's like when you get a stuffy nose from the flu or from a cold or even just getting hay fever. So it's really saying pink eye, stuffy nose, and a cough. Afterwards, you may start getting some bluish, whitish spots on the interior surfaces of your mouth in the cheek areas. These are called Koplik spots, and they're very specific to a measles infection. So if you've ever had strep throat, you might be familiar with those whitish spots that tend to be in the back of the mouth and on your throat. But with these Koplik spots, they are a bluish white, and they tend to be on the interior surfaces of your cheeks. These are then followed by getting a rash and a high fever. And that rash can last anywhere from 1 to 2 days before or 1 to 2 days after those Koplik spots first start popping up. And they last about 5 to 6 days in total. You're going to get the rash, and then it's going to disappear, first on your head and your face, which sounds like chicken pox to me, at least my experience. And then it's going to go outwards and downwards until it finally reaches your hands and feet. So it's kind of going to creep along your body as it spreads. That makes a lot of sense because of how your nervous system develops too, or how it's really spread out anatomically in your body. Then you're going to get a persistent cough, and that can last up to 1 to 2 weeks after your rash goes away. Measles can affect approximately 30% of infected individuals with complications, and that particularly happens to young kids and adults. So by young children, they define that as being under age 5 and adults as being over age 20. One of the most common complications is diarrhea, and another is pneumonia. The leading cause of death for adults as associated with measles is acute encephalitis, so a swelling of the brain. But that's a very rare complication of measles that only happens in about 0.1%. Unfortunately, though, this data suggests that this particular complication and complications in general may be more severe in pregnant women. So at the very least, if you are not vaccinated or your children are not, or they're on a delayed schedule, do make sure to keep them away from pregnant women and small infants. And that's really because in addition to harming the pregnant woman, getting exposed to measles while you're pregnant can cause fetal defects in addition to those in the individual who is pregnant. So 15 out of 58 women who were studied by the CDC, and these women were pregnant and they had active measles, were followed to see what affected them as the parental figure who was pregnant and also the fetal effects. 15 out of those 58 developed pneumonia. 2 out of these 58 pregnant women died. The most common fetal effect that was found in this study was premature delivery, and that happened in 13 out of 58 of these women. And remember that 2 of them died, so 13 out of 56 who survived were having these premature deliveries, which can be dangerous for babies in and of themselves. Additionally, 5 of the pregnancies resulted in spontaneous abortion, and that means that the body just rejected the pregnancy. You want to be really careful with this because that means that 7 fetuses did not make it through. So 13 out of 51 of these pregnancies resulted in premature delivery. In 2 of the cases, both mother and fetus died. And in the cases of 5 of these individuals, the fetus did not survive. So if a non-immune pregnant patient is exposed to measles directly prior to delivery or around the time before delivery, they could very well pass this on to the fetus, and it could cause severe complications up to and including death. Measles has not been shown to cause birth defects, but I would say that spontaneous abortion for a wanted pregnancy is a very strong side effect that matters very much in and of itself. The risk for obtaining these types of issues can be reduced with passive immunization. If you are interested in that, please do reach out to your doctor. If you suspect that you may have measles, go ahead and reach out to your doctor as well so they can check you using your urine, some nasal or pharyngeal secretion swabs, throat swabs, or drawing your blood to check it for a viral culture. We're going to go on a quick break, and when we come back, we're going to talk about mumps. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Before the break, we were talking about the MMR vaccine that folks tend to get when they're small, and mostly how measles works, how humans are the only natural host of this virus, even though it is highly contagious, and how it goes through our body and ends up killing many individuals, especially as it is very contagious between the person who is pregnant and their fetus. Now we're going to talk about mumps. Mumps is very similar to measles in that it's caused by an RNA virus, and they're both in the Paramyxoviridae family, but they are in a separate genus from each other. Mumps also has no animal reservoirs. It is also a strictly human disease. Mumps can also happen at any time of the year. You can contract it at any time, but it's similar to the flu in that it has peak incidences. So you may be more likely to contract the mumps in the winter or in the spring seasons. The reports of mumps cases in the U.S. have declined by over 90% since the pre-vaccine era. And by that, we're talking about like 1968, when they had 212,000 reported cases. But mumps outbreaks do still occur in the U.S., and they also occur all over the globe. There have been large outbreaks in recent years, though, especially within the past decade. And that includes one in the Midwest in 2006 that had 6,584 cases, and another along the east coast of the U.S. and Canada in the 2009 to 2010 season, in which there were 3,502 recorded cases. For the folks who had immune records available in that outbreak, 90% of them had received at least one dose of the mumps-containing vaccine, typically that MMR vaccine that's meant to combat both measles, mumps, and rubella. There are also different individuals who are susceptible to different degrees. Mumps tends to be transmitted via droplets of saliva or mucus from your mouth, nose, or throat if you are infected. And so that means if you sneeze or cough or share food or beverages with someone who's infected, then you could get that anywhere from 3 to 4 days before the onset of that disease's classic characteristic. That characteristic is called parotitis, and that means that your parotid gland is inflamed or swollen. Remember, itis always means inflamed or swollen when we're talking about diseases in the human body. So that area gets swollen or inflamed, and that is the area that is kind of behind and under your jaw and near your ear. It can be located as far up as about the real hole where your ear is. That's called your external auditory meatus in the bone. And signs of mumps may include swelling of that parotid gland, which makes it look like your back jaw area and right in front of your ear and down part of the top of your neck are very swollen, as well as some ear pain, especially when you're chewing or having some difficulty swallowing. But there are infected folks who don't have those classic symptoms, and they still have the potential to transmit mumps to others who are susceptible to exposure. So if others are not having these vaccines for it, then they may very well get mumps transmitted, even if the others seem to be asymptomatic for mumps. There are individuals from countries that don't have routine immunization against mumps as well, and they're more likely than others to transmit that to the United States. Imported mumps cases in the U.S. can also happen with routine mumps immunization programs. So there was a little boy in 2009 who was 11 years old, and he was traveling from the UK to New York, and he transmitted it to a lot of folks. And that's what resulted in that spread across the U.S. on the East Coast and into Canada. And 53% of those reported cases that year involved school-age children who were 5 to 17 years of age. And that's most likely because they were exposed in school. We don't really observe a lot of social distancing in schools, and that is one reason why everyone has been schooling from home for the past few months with COVID-19. A lot of the students who contracted this were exempted from receiving that MMR vaccine because of medical, religious, or philosophical reasons, or because their parents said they were afraid the MMR vaccine would cause autism, which I can tell you, as having worked as a legal assistant for a law firm that specifically sues the Department of Health and Human Services for vaccine-related injuries, most lawyers will not take a case for saying that vaccines caused autism, because there is no real medical and scientific research that supports the claims of the doctor who originally made that claim. That's why it's considered to be a bad faith case. And that means that you're taking a case before the court that you know is not grounded in facts. The Department of Health and Human Services in the United States recognizes that some individuals may be harmed by vaccines, but that does not mean that they can obtain autism from them. There are multiple disorders and issues that can be the result of vaccines, and they're relatively very rare. But because they do exist sometimes, the Department of Health and Human Services does set aside money to compensate individuals for that. That's what we call in statistics as being an outlier. It's something that happens sometimes, but it's typically not very statistically significant. It's not happening frequently enough to warrant total cessation of the program. They're just one or two here or there. So I have worked at a law firm that was involved in that, but we always rejected cases that were specifically related to autism because it is a bad faith case. Autism is not shown to be caused by vaccines. Much like measles, mumps can also be transmitted, though, by areas where people are in close proximity, like airports, colleges, and even large households. And that's why a lot of colleges require that you have certain vaccines prior to attending, especially if you are going to live in the dorms. You start getting the first symptoms of mumps about 14 to 18 days after you are exposed, and then the parotitis starts developing. The initial stage is going to include just generally feeling icky, having some headaches, and a low-grade fever and anorexia, in addition to general muscle pain. So it might first start out by feeling kind of like the flu. But up to 40 to 50% of the folks who get infected have non-specific symptoms of this just feeling kind of crappy, like you have the flu. An additional 20% of people who get infected are entirely asymptomatic. And then the remaining infected population is at an increased risk for developing that swelling of the parotid glands, and that can either be on one side of your jaw or both. Your salivary glands may also inflame, but that will decrease after about 1 week, and you can have a full recovery in up to 10 days. There are complications that are associated with this, though, and that can include aseptic meningitis in under 15% of individuals, pancreatitis in about 2 to 5% of folks, oophorytis in 5%, and that's the inflammation or swelling of your ovaries. You also see swelling of the brain tissue and the brain membranes in about 1 out of every 50,000 cases, and even deafness in 1 out of 20,000 cases. You also can see that measles and mumps both impact pregnant individuals. Pregnancy doesn't cause mumps to be more severe, like what happens with measles, but if the person who's pregnant is exposed to mumps during their first trimester, then there is a higher risk of them spontaneously aborting the child. And that means that a lot of times, before women are even knowing that they're pregnant, about 10 to 12 weeks in, they may already be exposed to this virus. So it's not enough to just avoid being around folks who know they're pregnant, because a lot of times folks are pregnant before they're even aware of it. That's just simply how it works. And that's why we have pregnancy tests that are over the counter, as well as blood tests at our doctors. So you may not even know that someone is pregnant and extra vulnerable and that you need to avoid them. With mumps, this spontaneous abortion, also referred to as essentially being a miscarriage, has been found in 27% of pregnant women who were exposed to mumps during their first trimester, as opposed to 13% of the control individuals. So that means that they are twice as likely, at a minimum, to miscarry a fetus if they are exposed to mumps. Much like measles, though, the primary effect that's deleterious to pregnant individuals and their fetuses is actually death of the fetus. It's not necessarily going to cause birth defects, but it will just entirely kill the fetus. Unlike measles, in which the pregnant individual can receive some immune globulin injections to suppress a lot of those measles-induced symptoms until after the pregnancy and help to reduce the neonate or the baby from getting measles, there is no treatment in this fashion for mumps. It is solely related to relieving the symptoms, very similar to treating the flu. If you believe that you may have mumps, make sure that you reach out to your doctor so they can perform some tests. We're going to go on a quick break, and when we come back, we're going to talk about rubella. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
Talking about mumps. Now we're going to dive into rubella. Rubella is called German measles, and it is also an RNA virus, but it's in a different genus and family. The genus for rubella is rubivirus, and it's within the Togaviridae family. This human disease also has no animal reservoirs, though. The incidence of cases of rubella tends to be highest in late winter to early spring, and we see that that is fairly common for the viruses in the MMR vaccine. The specific number of rubella cases has progressively declined in the U.S. since the pre-vaccine era, thanks to mass immunization programs. As of the year 2004, it is no longer considered to be endemic in the U.S., but it does still remain endemic in other countries that have a dramatic increase in cases that were reported during 2009 in comparison with the year 2000. The World Health Organization also has reported that rubella cases in the African region and the Southeast Asian region increased from 865 to 17,388, and from 1,165 to 17,208 during the years 2000 and 2009, respectively. Those specific regions represent a significant amount of these 121,000 global cases of rubella that were reported by the World Health Organization in 2009. One thing both regions have in common is that they don't have any specific goals to help prevent and control the spread of rubella. Rubella eradication isn't really possible without having these global immunization initiatives. Having these are very imperative in having them implemented and enforced to prevent these from spreading across the globe in an era of globalization. Traveling around the world is easier and cheaper now than really ever before. And so if these viruses are endemic in other areas and folks who are not immunized travel to those areas and then come back, they can really put a lot of folks who are not immunized at risk, especially those with autoimmune disorders or those whose immune systems are compromised from issues like chemotherapy. There are many different reasons that folks may have a compromised immune system, and more folks have compromised immune systems than I think many individuals tend to guess. Remember that if you have diabetes, one of the features of diabetes is that you have trouble healing wounds. Your body has trouble healing in general, and a great many folks in the U.S. have diabetes already or have pre-diabetes, so they are already at an increased risk of getting this disease and also of perhaps even dying from this disease. About 71% of cases, at least in 2003, of rubella were among individuals who were of childbearing ages. So ages 15 to 39, so after puberty and before menopause. And that shift in demographics from being a childhood disease to being one that's affecting people of childbearing ages means that there is an increase in the probability that folks will develop congenital rubella syndrome if the outbreak occurs. Rubella cases reported in the U.S. right now tend to involve a high proportion of Hispanic-born young adults who are from countries who lack routine administration of those rubella-containing vaccines. And there's also a majority of CRS cases reported in the U.S. since 1997 amongst infants and kids who were born to foreign-born women who were from Latin America or Caribbean countries. Much like measles and mumps, rubella transmission tends to occur by coming into contact with droplets from someone who is infected during the last week of that 2 to 3 week incubation period. And that's up until about a week after the development of getting that rubella rash that is classic as a symptom for that disease. However, folks who are asymptomatic or who don't have a typical clinical presentation of this infection can also transmit the disease. So with mumps, we talked about how sometimes women who don't even know they're pregnant yet, and they're definitely not showing, may already be at risk. But in the case of rubella, we're also seeing that folks who don't exhibit any symptoms can also transmit the disease, much like COVID-19. So it's important, even if you don't think that you have it, if you've not been vaccinated for it especially, you need to stay away from a lot of other people who are more vulnerable. Additionally, infants who have congenital rubella syndrome may also shed large quantities of that virus in their bodily secretions for over a year after they're born, and they can be highly contagious. Non-immune pregnant women who come into close contact with either the baby or anyone else who is infected may be at risk for acquiring rubella infection, and that means that in turn their fetuses may also develop rubella-induced complications. So we talk about this asymptomatic expression or not having all of the classical clinical symptoms being expressed. And how many people does that really affect? Well, in the case of rubella, That is up to about 50% of exposed individuals, and this is especially true of children. Of the folks who have classic clinical symptoms of the disease, those symptoms tend to be mild and limited. In the initial stage of the disease, you have about 1 to 5 days of having a low-grade fever, being generally tired and feeling crappy. You may also have swollen lymph nodes and an upper respiratory infection. There's also something called Forkheimer spots, and those are like little petechia on your soft palate. So little blood vessel bursts, more or less, and they might come before or along with that rubella rash. And that rash tends to be mild, but also maculopapular. And so that means that you may have these flat, reddened little areas, but also some little bumps. But the redness may only be super evident in folks who are very light-skinned. So you can't rely only on the presence of that rash to be indicative of rubella, and especially not just as it presents in lighter-skinned individuals. This rash typically starts on your face and then extends downwards, and it occurs about 14 to 17 days after exposure, and you typically only have it for about 3 days. Rubella can lead to arthritis in women up to 70% of the time. You can get these joint symptoms and also pink eye, most commonly if you are pregnant, but you can also get that swelling of the brain material and the lining, the membranes, about 1 out of 6,000 people, and that tends to affect female adults much more frequently than it affects men or even children at all. You can also get complications in pregnant women and their fetuses because of this infection. Acquired rubella is generally pretty mild, but if it crosses the placental barrier while someone is pregnant, it can cause devastating consequences like that congenital rubella syndrome we discussed earlier, in which infants may be still shedding viral cells over a year after they are born. And this stage happens about 5 to 7 days after exposure. If you do get this, getting a reinfection in a mother can be rare. But these congenital rubella symptoms include fetal death / spontaneous abortion, a premature delivery, having abnormalities of the eyes, including cataracts, as well as neurological issues like intellectual disabilities, abnormal heart development, and very frequently deafness. Congenital issues may be present when the child is born, or they can even develop months to years after birth. There is such a thing as delayed congenital rubella syndrome, and that can be resulting in type 1 diabetes, as well as subacute encephalitis, that swelling of the brain membranes and other tissues. As the pregnancy progresses, the frequency and severity of CRS tends to decrease. So if the pregnant individual is exposed to rubella in the first 12 weeks of pregnancy, that first trimester, then that results in CRS in 85% of developing fetuses or embryos. If it doesn't happen until the 20th week, then that risk of congenital defects is minimal, just based on what is affected by this virus. However, getting this infection in infants is still possible when non-immune mothers transmit rubella to the fetus close to the delivery stage. The severity and frequency may very well be lessened, but it can still be problematic. If you think that you may have rubella, it's important to reach out to your doctor so that they can confirm that with a lab test. And this is often done by doing a throat culture, just like you would for strep throat, or by also swabbing your nasal area. There is not a specific pharmacological treatment for rubella. They may be able to give you some immune globulin shots into your muscles within 72 hours of exposure if you're pregnant to try to suppress the symptoms, but it's not going to be able to entirely eliminate it. Additionally, even if a pregnant individual gets this treatment within the 72 hours of exposure, there have still been studies that have shown that infants have still been born to these women with congenital rubella syndrome. So it's not a routine prophylaxis, and it should only be given if the patient chooses not to terminate her pregnancy. Otherwise, it's just going to be a treatment course of treating the symptoms, much like treating the flu. We're going to go on a quick break, and when we come back, we're going to talk about the MMR vaccine. Stay tuned.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Now we're going to discuss the MMR vaccine. So today we've discussed measles, mumps, and rubella, and they're all RNA viruses that can also be transmitted across the placental barrier and result in the death of fetuses, as well as the death of or complications with the people who are carrying the fetuses. So measles, mumps, and rubella tend to have a lot in common, except that mumps tends to really have a big swelling of one or both sides of the jaw area near the neck and ear, but all of them generally have a lot of symptoms that are similar to the flu, like a loss of appetite and having perhaps a headache, but also a fever, and runny noses or coughs or sore throats. But they also sometimes have rashes or pink eye. Most of the time, these diseases are going to result in the child being spontaneously aborted / miscarried, instead of it causing any type of fetal defects. These aren't really associated with birth defects. They are more so associated with the fetus dying. Sometimes the mother can even die from it. And if they don't die, the children are still highly infectious once they're born and can also cause a lot of problems in other individuals as they shed these cells and just have these complications associated with types of deafness that aren't necessarily congenital, but are rather caused by this virus, in addition to other physical health issues. Fortunately, there is an MMR vaccine. This particular vaccine is very safe, and it's also effective at preventing all three of these diseases. Vaccines can have side effects, though, And I understand why some folks are reluctant to get them, because many folks who are pro-vaccine often act like vaccines never have any side effects. But there's a big difference in admitting that vaccines can sometimes cause side effects in outliers and that vaccines cause autism. Vaccines do not cause autism, and vaccines can cause other issues, but it's very rare. Getting an MMR vaccine is much safer for you and for your children than getting measles, mumps, or rubella. And most folks who get this vaccine don't have any serious issues with it. So the most common side effects of the MMR vaccine are your arm being sore from the shot. Sometimes you'll get a bit of a fever as your body is using the contents of the vaccine to help make those antibodies, those memory cells, so that it can recognize different forms of rubella or measles or mumps in the future. You could get a mild rash, and you could also get some temporary pain or stiffness in your joints. That's most common in teenage or adult women who did not already have immunity to the rubella component of the vaccine prior to obtaining that vaccine. So if you get it later in life, it may be more problematic. Just like if you get chickenpox later on in life, getting it as an adult can be a lot more uncomfortable than getting it as a child. The MMR vaccine has been associated with a very slight risk of febrile seizures. So those are seizures caused by having a fever. Fevers of this type following the MMR vaccine are rare, and they're still not associated with any long-term side effects. The risk of getting these seizures also increases as infants get older. So it's recommended that you get your kids vaccinated with this as soon as it's generally recommended. Delaying the MMR vaccine specifically can actually increase the risk of them having some of these side effects. Some people also get a little bit of swelling in their cheeks or neck. The MMR vaccine, though, very rarely can also cause a temporary low platelet count, and that can cause a bleeding disorder that is temporary, generally goes away even without treatment, and is not considered to be life-threatening. Very, very rarely, extremely rarely, a person could have a serious allergic reaction to the MMR vaccine. And anyone who has ever had a life-threatening allergic reaction to the antibiotic called neomycin or any other component of what makes up the MMR vaccine should not get the vaccine. And I think that it's important to understand that doctors and scientific researchers do recognize that there are individuals who may have allergic reactions to some of the components of the vaccine, and that they will discourage you from getting it if you have had a reaction to that in the past. They do keep that in mind. It is first and foremost about your health and safety as well as that of the folks around you, and they have taken an oath to do no harm. They are very much trying to protect everyone. Now that we know about this, when should you get an MMR vaccine? They recommend that kids get 2 doses of it, the first dose somewhere between 12 and 15 months old, and the second dose at 4 to 6 years old. Teens and adults should also be up to date on their MMR vaccine. Kids can also get something called the MMRV vaccine that will help protect against varicella or chickenpox in addition to measles, mumps, and rubella. But that particular vaccine is only licensed to be used in kids who are between 12 months and 12 years of age. So teens and adults are not eligible for that vaccine. They recommend, and by they I mean the CDC, that all kids get those 2 doses, and kids can receive the second dose earlier as long as they get it at least 28 days after their first dose. An MMR vaccine is given later than many other of the childhood vaccines because the antibodies that transfer from mother to child can also provide some protection against the disease, and it can also make the MMR vaccine less effective until the child is at least 1 year of age. So it's important that you pay attention to that vaccine schedule and follow along with your doctor's recommendation. You can read more about the MMRV vaccine and the MMR vaccine online at cdc.gov, and no matter where you fall on the vaccine decisions, I highly recommend reading about them from very scientific resources. It doesn't matter what Jenny McCarthy and other folks' opinion is of this, you need to be reading it from the medical perspective. Anyone can have an opinion, but you are entitled to your informed opinion, as Harlan Ellison has said. It's important to know the actual facts and to get the facts from very solid resources. If you are at a post-high school educational institution like a community college or a university, and you don't have any presumptive evidence of immunity, you will need 2 doses of your MMR vaccine, and that will need to be separated by at least 28 days. If you're an adult and you also don't have presumptive evidence of immunity, you should get at least 1 dose of the MMR vaccine. Different adults may need 2 doses. It just really depends, because remember, in addition to looking at this holistically, we are still all individuals. Some of us will be allergic, some won't. Some of us will need fewer doses, some of us will need more. If you're going international with your travel, or you're going to be in any other setting that can pose a high risk for measles or mumps transmission, like working in the healthcare or death industries, then you may want to make sure that you have had those 2 doses separated by at least 28 days as well. They recommend that students who go to college, who are healthcare personnel, death work personnel, international travelers, or folks who work in public health get these vaccines because they may be at an increased risk during an outbreak. You can look online for more information regarding the timing of these vaccines, and I also recommend that you speak with your doctor. There's also a list of folks who should not get the MMR vaccine or who should wait. If you have severe life-threatening allergies or an allergic reaction after a dose of a vaccine, then you may be advised by your doctor not to vaccinate. Ask your healthcare provider for more information about the components of that vaccine and the specific components to which you are most likely to be allergic. Different vaccines have different components, and you may not be allergic to all vaccines. If you're pregnant or think you might be pregnant, you need to wait to get that MMR vaccine until you're no longer pregnant. Talk to your doctor about how long you need to wait, and also women who have recently gotten the MMR vaccine need to wait at least 1 month or more before getting pregnant. If you have a weakened immune system, and that can be for any reason from cancer to HIV/AIDS or getting medical treatments like radiation, chemo, steroids, or immunotherapies, then you should not get this vaccine. If you have a close relative, like at the parent or sibling level, who has a history of immune system problems, talk to your doctor about that first. That family history is important, and it can be informative as to whether or not you may be at an increased risk. If you've ever had a condition that results in you bruising or bleeding easily, like hemophilia, then you might want to avoid this. Also, your doctor may recommend against it if you've recently had a blood transfusion, or you have had tuberculosis, or you've gotten vaccines in the past month of different types, or if you're not feeling well, like if you have a cold or the flu. In those cases, your doctor might recommend that you merely delay your vaccine for 3 months or more. It really just depends on your specific experience. If you were born before 1957, or if you've had blood tests that show you're immune to measles, mumps, or rubella, or if you have had at least 1 dose of an MMR vaccine on or after the first birthday for preschool-aged kids and adults who are not at high risk for exposure and transmission, then you can talk to your doctor about perhaps not needing that MMR vaccine. You may have acquired immunity in a different manner. So now that we've covered the risks of the diseases and the risks associated with the vaccine, I want to wrap up this episode by just giving you guys some numbers. So 1 dose of the MMR vaccine is 93% effective against measles, 97% effective against rubella, and 78% effective against mumps. If you have 2 doses, that is 97% effective against measles, 97% effective against rubella still, and 88% effective against mumps. So it gives you a 10% increase in its effectiveness against mumps. That is significant. Now, sometimes folks who have received the vaccine will still get measles if they are exposed to the virus. That's only about 3% of individuals who have had 2 doses. But you're much more likely to have a milder illness, and you're less likely to spread that disease to other people, like women who were pregnant and their fetuses who were at much higher risk. 2 doses of the MMR vaccine can really be helpful in not getting the mumps. We said that's at 88% effectiveness, and during an outbreak, public health authorities might recommend an additional dose for folks who are at an increased risk for mumps. That additional dose can help improve protection against mumps and their complications. There are not that many studies available related to rubella in this regard, but most people who don't respond to the rubella component of the first MMR dose are generally expected to respond to the second dose. The CDC and FDA do continuously monitor the safety of vaccines, even after they're approved, and if they find any problems with the vaccine, they will inform health officials, healthcare providers, and the public. The CDC uses 3 different systems to monitor vaccine safety. The first is called VAERS, Vaccine Adverse Event Reporting System, and that is an early warning system to help both the CDC and the FDA keep an eye on problems after vaccination, and anyone can report possible vaccine side effects to them. The Vaccine Safety Data Link, or VSD, is a collaboration between the CDC and 9 separate healthcare organizations that allow for ongoing monitoring and proactive searches of vaccine-related data. The Clinical Immunization Safety Assessment Project, CISA, is a partnership between the CDC and several different medical centers, and they all conduct clinical research on vaccine-associated health risks. If you would like to learn more about vaccine safety and clinical research in this regard, you can take a closer look at cdc.gov/vaccine safety and read more about them there. And you can also go online to texasvaccinelawyers.com if you believe you have been injured by vaccines. Remember, though, that vaccines do not cause autism, and that most lawyers, including texasvaccinelawyers.com, will not take those specific cases. However, for other types of vaccine injuries, you may very well request a free consultation via the website or the number listed online. That's all I have for you today. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.